All right. Hi, everyone. We're very excited today to have with us Dr. Natalie Leong from the University of Maryland Medical Center. Just a quick introduction about Dr. Leong. She's an assistant professor at the School of Medicine in Maryland. She's also had extensive training in the field at Harvard, UCLA, and Rush Sports Medicine. And now, on top of treating patients and doing surgeries, she also runs a research lab at UMD focusing on ligament and tendon tissue engineering and regenerative medicine. So thanks for joining us today. How are you?
Great. Thanks for having me.
Yeah, this is great. We've done this with a couple doctors and it's gone really well. So we just want the community to know that you guys are out there, and then hopefully they can learn a little something from you today, which I think is great.
Absolutely.
So to start off, so what was kind of your reason getting into sports medicine and surgery?
So I really love the actual surgeries we do, the minimally invasive arthroscopic surgeries. And the patients we work with in sports medicine are really nice in that people are very motivated to get better, to do what they were doing before, whether it's going back to work or athletic activities. And they tend to actually get better after surgery. And that's not something you see in every orthopedic field.
Yeah, I mean, I definitely think that's true, and that's a great reason for wanting to get into it, right? So just so viewers know, what kind of injuries do you see in the office, maybe day to day and throughout the week?
So I mostly treat conditions of the shoulder and the knee. That ranges from any meniscal injuries in the knee, ligamentous injuries like ACL, MCL type injuries, any tendon tears through the body like quad tendon, patellar tendon, hamstring tendon, and then also shoulder conditions like shoulder instability, labral tears, rotator cuff tears, and various tendinitises.
Yeah, I mean, I was fortunate enough to spend that one morning with you, and I have to say, you saw a bunch of different things, which I'm sure
Yeah.
keeps it exciting and fun, right? Keeps you on your toes a little bit.
Yeah, I think of sports medicine as a lot of soft tissue injuries throughout the body. So there's similar principles in treatment. So even though it's mostly shoulder and knee surgery, there's also a lot of other things we do as well.
Yeah, definitely. And I'm sure we'll jump into that in a little bit because I know we're going to talk about some PRP injections and some things along those lines. Do you have a favorite sport that you like to treat, or like a favorite athlete you like to treat?
I pretty much like treating any athletes.
Yeah.
But I would say that most commonly we see injuries from contact sports like football, is a big one during the fall season. I serve as a team doc for Centennial High School, so we're very involved there. But also lots of skiing injuries and soccer injuries, and
Yeah,
runners tend to have overuse injuries as well.
definitely. Well, I'm glad they have you because, like you said, football, I'm sure you see a lot of contact injuries. So that kind of being said, when you do have a patient that comes in, maybe what ones tend to lead towards surgery versus what ones tend to lead towards more conservative management?
So I think the acuity of the injury matters. If you had a tendon that was previously connected that suddenly tore off, often that's something that's going to need surgical repair. Likewise, if you had a sudden injury and your knee swells up and that's never happened before, it's more likely to be a sign of something that needs surgery. If it's more an overuse or a gradual wear and tear type issue, it tends to be more amenable to conservative management.
Definitely. And I know listeners probably appreciate you touching on that because a lot of times we'll get calls to being like, this happened. Do I go to a doctor? Do I come into you? And like you said, if it's a pretty severe acute injury, majority of the time we're saying, all right, call up Dr. Leong and get in to see them because we want to check that out before you come in. So I think that was a really good definition of how to decipher between the two of when maybe you might need surgery.
Yeah, I think it's always reasonable to go in to see a sports doc if there's any concern. And if it's something non operative, we have no problem talking about it and referring to physical therapy.
Yeah,
Yeah.
I think is great. Yeah. A lot of, or I guess I'll say this, some of the contact injuries you do see,
Mm-hmm.
do you think some of those could have been prevented, or majority of the time, do you think it's kind of just I don't want to call it like a freak accident, but a freak accident where something happens, next thing you know, they have a torn ACL or their Achilles is torn or they tore their rotator cuff?
I think it's both.
Mm-hmm.
There's a lot of research out there that shows that if you have good neuromuscular conditioning, especially in women athletes, if you jump properly and land properly, you can reduce the chance of an ACL tear in a contact sport. That said, there's a lot of freak accidents out there where people who aren't necessarily engaged in athletic activities still get athletic injuries.
Yeah.
Like, lately it's been the quarantine from coronavirus, and people aren't playing sports, but I'm still seeing ACL injuries from like tripping over laundry baskets at home. It happens.
Oh,
You
yeah.
know?
Yeah. I mean, I definitely think that's true. And if someone's thinking like, oh, how can I make my, neuromuscular education better? If you have a really good trainer, that would help. A good PT
Mm-hmm.
helps, even like a good sports med doc, that all helps. So I think that's great and definitely some good points. So you kind of just touched on this a little bit. You're still seeing ACL injuries, unfortunately.
Yes.
I mean, I know sports are ramping back up, so hopefully not, but I'm sure you'll see a couple more of those as well. But besides the sports field, are you seeing a lot of injuries that happen at work as well too?
Yeah, I do have a fair number of patients with on the job injuries because
Mm-hmm.
I have a clinic close to the hospital, University of Maryland. We do see a lot of healthcare workers with work related injuries. A lot of times in the upper extremity, mostly like shoulder injuries, um, because of the physical nature of the work that they do, but
Yeah.
also in manual laborers, construction workers, a lot of like tendon injuries and falls and things like that.
Yeah, definitely. I think sometimes individuals who have such strenuous jobs, maybe just because they've been doing it for so long, but don't even realize they're basically athletes.
Yeah,
Like,
exactly. They're occupational athletes. They don't always think of themselves as sports medicine patients, but absolutely.
yeah, yeah. So I think it's good that you touched on that too. So people know, like, oh, I do have shoulder pain. Like, I should go to a sports medicine doctor because my work requires me to do X, Y, and Z. It's not like you're lifting 5 pounds, you have to lift like 60 pounds.
Right. A lot of my patients aren't athletes. They just have
Mhm.
what we consider sports injuries, which is really soft tissue injuries, tendon and ligament injuries. It doesn't have to be you were playing, in a football game and then this happened to you.
Yeah, exactly. I think that's a little bit of a misconception, just in the field.
Absolutely.
Yeah, I think it's great that you brought that up, and hopefully this sparks people to think about things maybe a little differently when they're seeking out a doctor or a physician. Um, to change tracks a little bit, I know we talked a little bit about surgery. Can you talk a little bit about what PRP injections are, as well as stem cell injections? Mainly, like, we have a lot of patients who come in asking questions, and I think it'd be great for the community to know a little more about this.
Yeah, absolutely. It's something that there's a lot of information out there. Some of it is right, some of it is not. Starting with PRP, that stands for platelet-rich plasma, which is basically a treatment where we take blood and we draw it from your vein like a normal blood draw, and then we spin it in a centrifuge machine. So we separate out the platelets and the growth factors from all the other stuff in your blood. So, like the red blood cells and the white blood cells, we throw those out, but we keep the platelets and the growth factors. And although it's still considered semi experimental, there's been good data to show that it can be effective in certain tendinitises, like if you have a tennis elbow or a patellar tendinitis, it can be helpful. And also in people who have mild arthritis. It doesn't necessarily grow back things that are torn, which sometimes it's marketed that way, unfortunately, but it is more like harnessing a bruise and kind of like injecting a bruise into a site to help with a pain response as well as sometimes a healing response.
Yeah, definitely. No, I
Um,
think
the,
that's great.
the thing that patients need to know is that most insurances don't cover PRP.
Mhm.
So it is an out of pocket procedure. At the University of Maryland, we charge $500 out of pocket for the procedure, which is on the low side for PRP injections.
Yeah, I was going to say that's definitely on the low side compared to some other things I've heard from other friends who are physical therapists and doctors. So that's definitely good to know too.
Yeah.
So go ahead.
It's a relatively simple procedure. It's done in the clinic, takes 15 minutes. It's not a big deal.
Yeah.
So you don't go to a surgery center or anything for something like that.
Yeah. So what kind of patients do you see that have been maybe benefited from this or been appropriate for this?
Yeah. So, for example, somebody who has very mild arthritis, and they've already tried things like steroid injections and gel injections and not had the response they were looking for, that would be a good option. For people who have tennis elbow that have gone through the tennis elbow strap and done the physical therapy and still have pain, it can be more reasonable of a measure to take than going to surgery for something like that. In my practice, it tends to be at the end of the year when people find they still have FSA dollars that are use it or lose it, that they're like, well, maybe now is a good time to go get some PRP injection.
Yeah, I'm sure that can maybe sway someone's decision a little bit too, even if it's subconsciously. But no, that's great. That's great for people to know as well, and any other therapists listening too. So we also had a couple questions just from the community. We just took some questions or put a poll out there on Instagram and Facebook and just had some people ask some questions. So first question, I'm assuming this is someone who's obviously in pain, but they ask, what is the best way to deal with pain that doesn't include medicine?
Okay. Well, first off, it depends what kind of pain.
Exactly. Yeah.
If it's a more chronic type pain, which I'm guessing this kind of question is leading, most orthopedic things can be dealt with activity modification, making sure you're at a healthy weight, and anti-inflammatory measures, whether it's putting ice on something that's swollen or inflamed, or taking an over-the-counter anti-inflammatory if you can stomach it, or potentially a steroid injection. But it really depends on what exactly is the issue. There's plenty of non-operative measures. If pain is the main issue and it's not something that's detached to the point that it needs to be fixed, it tends to be a non-surgical problem. And of course, physical therapy is a huge part in that as well.
Yeah. Yeah. And I would encourage maybe someone who's thinking along those lines to seek out like a sports med physician like you, so you could do a little bit more of the detective work and figure out what might be going on and the best way to resolve it. But like you said, yeah, ice definitely helps. Any anti-inflammatory measures they could take would definitely help. So another question, they are a little broad questions, so we'll go with it. But what should I do if exercise hurts? So I'm guessing this person kind of all exercise must hurt, but they ask, what should I do if exercise hurts?
So in general, when things are hurting and you're not recovering from a surgery or anything, it's your body's way of telling you that maybe you need to back off a little bit. First, having some assistance from a professional, whether it's a physical therapist, athletic trainer, somebody to make sure that you're having proper form in your exercises, can be helpful. Going in to see a sports medicine doctor to see if there's an underlying issue that needs to be treated, or just modifying activities. For example, if people have a lot of knee pain when they're starting to get a little bit of arthritis, impact activities are not the best, such as running or jogging, but if you switch to elliptical or biking or swimming, that might work better.
Yeah, I think those are all great points, and it just goes to show like there's a lot of different options out there. If exercise does hurt, it's not like you have to sit there and deal with it and stop completely, because I guess we see a lot of patients that stop completely and then try and start up again, and then stop completely and try and start up again without seeking those avenues, like you said, like a sports med physician, athletic trainer, physical therapist, strength coach, all of those things. And I'm sure there are a lot of people at home now wondering about this, just with everything going on with COVID and and whatnot. So I think those are great options. Yeah. And then I know you touched on this a little bit in the beginning when I asked you the first question, but do you see patients after an injury get back to 100%, back to where they want to?
A lot of times, yes. It depends on the nature of the injury, of
Mm-hmm.
course. But many things can be treated where you get back to doing everything you want to do. Some injuries, it may not be reality, but that's a very injury and person dependent kind of issue.
Definitely, most definitely. And then this one's a little more specific, but what considerations should I have or think about when I'm choosing an ACL graft?
Okay, so if you have an ACL injury, the biggest decision is whether you get an autograft, which is tissue from your own body, versus allograft, which is tissue from a donor. And in general, it goes by the level of activity and your age and your expectations for after surgery. So if you're a younger athlete, taking your own tissue is generally better because it's live tissue, and there's better incorporation into the graft tunnels when we put the ACL. Downside of taking your own tissue is that there's what we call donor site morbidity, which is pain and the fact that you'll be missing some tissue at the site that we take it from. So in general, like a collegiate athlete who's serious about returning to sports, I would recommend them to take their own tissue. If it's somebody who's one of those freak accidents that says they just want to get back to living their life without their knee giving out all the time and have a lot of work obligations, want to get back as soon as possible, I would recommend a donor graft because it doesn't hurt as much and the recovery is just a little bit easier. And then once you decide whether your own tissue or not, there's questions about whether you take your hamstring, whether you take patellar tendon graft. I tend to favor the bone patellar tendon bone graft, where you take the middle third of your patellar tendon with a little piece of the kneecap and a little piece of the tibia, because I think that having bone healing in both ends is better than having tendon to bone healing. But that's a personal decision with a lot of factors. I think as a sports medicine doctor, it's my job to make sure my patients understand the pros and cons of each option and then make the decision that's best for them. None of these are perfect options, and that's why I spend a lot of work in the laboratory trying to find a way that we can use very specific stem cells to regrow a natural ACL, but that's going to take a little bit of time.
Yeah. I mean, I think that's really unique in the fact that, you know, you're not just seeing patients in the office, you're seeing what it looks like in the surgical room, and then you're also seeing what it looks like in the lab and trying to tie all those together. So I would definitely, you know, say that's such a positive for when patients come to see you too. And like you said, depending on your life circumstances, especially this person asking the question, depending on what they want to get back to, it can be a completely different answer, right?
Absolutely.
Yeah, so I think that's a really good point, because a lot of people, you know, just Google, oh, what graft should I get? And let's say the first thing that pops up, which I know this isn't the case, but is like quad tendon.
Mm-hmm.
And they get stuck on that. And then thank gosh they have someone like you to educate them, like, okay, that's good for this, but maybe we need this instead. Like, this would better fit your goals.
Yeah, there's absolutely people who quad tendon makes sense, but there's not a cookie cutter solution for every patient.
Exactly. Yeah, exactly. So that's great. So now, you know, we've talked a lot about different things, PRP injections, surgeries, changing a little bit to where you are now. Can you just let everyone know kind of like where you're practicing? Are you guys doing surgeries right now? Are you doing telehealth? Are you doing in-person appointments? All that fun stuff?
Pretty much all of the above. We are having in-person appointments for people who have things that need to be seen in person, whether that means it's an acute injury or they have a need for something hands-on like injections, or if they have a physical exam that needs to be done to clarify even beyond what we can see on the imaging. My main clinic sites are at Camden Yards, so downtown Baltimore, where the Orioles play. that's one site. And then I also see patients at our Columbia clinic at the University of Maryland office in Columbia. And we do surgery at the University of Maryland, but that's mostly for inpatient surgery traumas that come in. Elective surgery is at University of Maryland Orthopedic Rehabilitation and Orthopedic Institute, also known as Roy or Kernan Hospital. And then a single OR surgery center in Columbia on Waterloo Road. That's really nice because there's only one OR, so there's one surgical patient at a time to minimize exposure during COVID. And then we offer telehealth with either video or phone appointments to patients during this time as well. And that's something we plan to continue even after COVID, because for various reasons, it's more convenient for patients to talk just briefly if they have something that doesn't necessarily require coming in.
Yeah, I mean, I think that's great. Just feedback I've gotten from patients with the telehealth sessions. They said it's been really nice if something happens and they feel like they can get a little bit of a quicker appointment with you guys. And then once they speak with you, it's like, okay, you definitely need to come in. We need to get some imaging. Or it's like, okay, we think it's just this, like rest, or go see your PT or go see your athletic trainer. So I know, I hate to call this silver lining because there's a bunch of terrible things going on right now, but maybe silver lining is like, this has been great for patients. I feel like they've been able to connect with you guys more, which is awesome.
I think so. It gives us a little more flexibility in scheduling.
Yeah.
And also patients who live really far away, sometimes it's difficult for them to get into a car, come downtown, worry about parking and all that.
Yeah, no, definitely. Last but not least, just to wrap this up, I know we've been getting a lot of questions like this, so I'd love to pose this question to you. Just with everything going on with the virus, what are some recommendations you have for maybe gyms opening back up? Or again, just recommendations for the public with the virus on how to kind of like remain active, try to remain pain-free, try to remain injury-free. I know sometimes, like you said, tripping over the laundry basket, it's just a freak accident, it happens, but what are some recommendations you have?
So obviously I'm not a public health official, but I encourage people to follow all the recommendations that are out there and be careful with social distancing and not exposing themselves unnecessarily. That said, I think it's important to keep your body conditioned even though you're stuck at home, whether that means doing exercise on your own at home on your own equipment, or sometimes you don't need a lot of equipment and you can even do exercise videos online or go outdoors in places that it's possible, like hiking is a pretty good activity to consider at this time. But I think the key is to not have a long period of inactivity and then go do a whole bunch all at once, because that's when we tend to see injuries. That you should ease into everything and be smart about what you do.
Definitely. And I think that's advice that could be applied to the 10-year-old baseball player who might be getting back into practices, to the, 50, 55-year-old who hasn't done much in the last month or two, just easing back into things, trying to stay socially distant, socially responsible, but trying to stay conditioned the best you can. So, yeah. Well, thank you, Dr. Leong, for taking the time to speak with us today. We really appreciate it. I know the community appreciates it. I know I definitely learned something today, so I can assure you our viewers did too.
Thank you, Lindsay.
Yeah, we'll talk soon, okay?
Okay. Bye.